Welcome to OrthoStatic, a podcast brought to you by the Academy of Orthopedic Physical Therapy. I'm physical therapist Jimmy McKay. Today, our guest has extensive experience in ergonomics, human factors, and body mechanics. He focuses primarily on preventing and managing musculoskeletal injuries in the workforce. Dr. Gordon Riddle, welcome to OrthoStatic.
Hi, Jimmy. Thanks for having me.
All right, so we have to go big picture first because I don't want to assume that everybody listening or watching on YouTube actually understands what workplace health is. I understand what workplace is and I understand what health is, but when you put those things together, what does workplace health mean to you? How do you describe it?
Yeah, I think it's a good point, and I don't think I knew that whenever I first kind of started out in clinical practice. But as I reflect, I think there's maybe like a couple different pillars as a physical therapist that we'd look at. And one of those would be ergonomic assessments, which that kind of gives us the ability to make recommendations or adaptations to the workplace design. So even work with like engineering on trying to design, like if it's a new build or a new building or a change in process, like being on the front end of that to try to really design and have the workers' physical health and musculoskeletal system in mind on that. A lot of it also is training and education. So which can be like movement training or safe lift training. And then maybe what more PTs are a little bit more comfortable with is mobility and stretching, flexibility programs, strengthening and fitness programs. And then even on like the pre-hire side, like fit for duty type of evaluations, or even helping to kind of come up with, I guess, a process or a test, so to speak, for a worker to maybe take before they actually are put into the job. So try to help the worker to be successful in whatever job that they're in.
That's a good overview. All right, so I think you might have touched on a couple of those things in those pillars, but how can orthopedic physical therapists contribute to workplace health programs? You mentioned a couple different big areas, but when your work with students or educating other physical therapists on this location or the way physical therapists get to interface with humans, how can orthopedic PTs contribute to workplace health programs?
Yeah, so really kind of how do we tailor workplace health programs to the worker? So like kind of performing an ergonomic assessment and really kind of integrating that into the workforce. So I guess kind of thinking about assessing or going into the workplace, looking at the observation or observing the worker kind of do their job, and then trying to use our analytical brain to identify what it is that we see that could be improved. So is the person is their posture less than optimal, or do they lack range of motion to do a certain part of the job? And then from there, kind of coming up with either individualized or job-specific kind of programs to help improve the worker themselves, right? Like to allow them to kind of live a little bit maybe with less risk of developing an injury, or also maybe less pain in their job or even at home. So
yeah, it seems like wherever a worker is going to interface with their job, whether that be a piece of equipment or whatever motion they're going to be performing a lot or all day, and what position those bodies in, feels like PT really is pretty poised to be at that intersection.
Yeah, I mean, absolutely. I think we are kind of movement experts. We have the ability to, help people to move better and minimize maybe some of their inefficiencies, which ultimately kind of like companies and employers like as well. Like they like efficiencies, and they also want to minimize worker time off. So I think if we have kind of a healthier, more well workforce, then we would tend to have a little bit better productivity, and also maybe just a little bit less people missing work less for various reasons as well. So yeah.
I'm sure there are a lot, but maybe let's just stick to a couple of the common workplace injuries that physical therapists can help, prevent or manage. What are some of the ones that come to mind when I mention that?
Yeah, I think back pain is such a common thing among non-workers, right? So I think it's still back and neck pain is a really common workplace injury. but also overuse type of conditions. So when you think about tendinopathy, tendinitis, kind of plantar foot pain, things like that. But really, when we get to prevention, like I work a lot in industry and in the environment where the worker is on the clock and working. And I tell people that I don't treat the injured worker, because if they have an injury, then they need to actually go through the appropriate processes by OSHA and submit the some type of report, and that kind of changes the whole dynamics. So on my end, it's a little bit, kind of maybe a little bit more on the preventative side, and I look for people who maybe complain of soreness or stiffness, or mention that there's something that they find challenging in their job, and then I try to kind of intervene on the front end to try to make improvements for them, so they don't actually have a point of where they have maybe symptoms that would cause them to report an injury. So
good. Now, how do you tailor wellness programs for different work environments? When work can mean a lot of things to a lot of different people. So what's your approach? How can you tailor those programs for those multifaceted, different work environments?
Yeah. Usually whenever I work in specific industries, I like to go and spend time with the employees, and kind of, if they're on the road, I like to ride along. If they're in a warehouse, I like to kind of stand next to them and see what they're doing, and really get to know them and talk to them, and talk to the safety team, and talk to the executive leadership team, and gather information first. And then once I kind of see and understand the job demands and the tasks themselves, and the environment, I think the environment's really important, and that's where ergonomics comes in. Then I'll try to develop or see what the priorities are, and see what's realistic to implement some type of a program. So, for instance, a union versus a non-union environment might have a little bit different implications on where it's where they're able to kind of implement some type of wellness program. And that being said, I'm always trying to balance optimal with like realistic or doable, right? Like optimal would be no restrictions. I can do what I want. Everybody kind of, they do aerobic conditioning at work. They do strength training several days a week. They're working on balance training, right? But that's not necessarily realistic. So it's how much time do I have, and what is the highest priority? And then I try to kind of fit that to it's the specific worker and or company that I'm working with at that time. So
yeah. Any work environments that you'd want to mention? I mean, I think when I picture, workplace health, I picture a lot of factories. I picture a lot of loading facilities. But what are some, workplace environments that maybe people wouldn't necessarily picture that a PT has been in?
Yeah, for sure. So, I mean, I've worked in warehousing. So like, that's probably kind of more what you were kind of imagining or thinking. So, essentially people kind of making orders, and it's really in the grocery industry is where I do a lot of my consultation. So they're kind of building pallets of cases of product that go to stores, and then they're loading it on trucks. And then actually, I've done a fair amount in the retail side, actually on the grocery store side, which is, I think, maybe a little bit interesting or surprising to some degree. So like, really, I'm in the other side of the environment, so where they have to unload the truck and break down the pallet and take things to their designated area, and then they have to essentially, a grocery store has a produce department, a deli, a prepared foods, a meat department, obviously their grocery goods, a bakery, right? So like, and in each department, there's several different jobs, and some have, in our opinion, like greater risk than others when it comes to kind of movement type disorders. So that's probably one area where I've spent the most time. I've also worked in like a medical tech company on their production side. So like, and they have an assembly line, and they also have a receiving area, as well as kind of a team that helps to quality control. So like and an office, like there was a significant amount of office employees there as well. So and then the last one I actually did was I worked with that I can think of anyway off the top of my head, is I worked with a nonprofit that they actually, they quote, rescue food. So they rescue food that's going to spoil, and then they give it to those that are less fortunate. So like and so they go all around the city and pick up different items, and then they have to try to distribute them to like local food pantries or churches or co-ops and things like that. And that was kind of interesting because I was like literally spent the day on the road with these people, and not only are they driving hours and hours, they have to climb up in and out of the box truck, in and out of the basement of a church, and they're handling every single package like by hand at least 4 times. So there's lots of repetition.
Yeah, and you've touched on this a few times, but talk about what role ergonomic assessment plays in workplace health. It feels like that's your chance to get your eyes or some measurements on the human involved in this.
Yeah, for sure. So ergonomics is really kind of fitting the workplace to the worker, right? So it's actually not fitting the worker to the workplace. It's fitting the environment and to the working population or the worker and that interface. So if we can really, we have two components where we can influence, and one of those is the worker, and that's kind of our traditional stuff that we can think about, such as like range of motion and strength and flexibility, and endurance, things like that physical therapists, it's kind of in our wheelhouse, versus like the environment is kind of like, it's our investigative eye. Like we want to make sure, and people have different statures, right? So the more adjustability there is in a workplace, the better. So I mentioned the bakery before, and a cake decorator, somebody who's decorating cookies or cupcakes or something, right? Somebody might be 5 feet and somebody might be 6'4". So we have to be able to kind of change the level for that person. But the principles of how they move shouldn't really change. Like that's what we do from a PT standpoint, is how we move. Those principles stay the same, but any type of adjustment we can have is really kind of what we're looking at in ergonomics. And I've also worked on a little bit on the engineering side, where trying to determine like what is an appropriate height for a certain amount of weight according to like the gross population, right? How much, if 75 to 90 percentile of the population, like how can we get to where they can succeed in whatever environment they're working in? So that's probably where I spend most time kind of ergonomically, is trying to balance and improve patient's posture, or not the patient really, I guess it's the worker, right? The worker's posture and their interface to reduce stress on joints, ligaments, and muscles.
Let's go big picture now. How can physical therapists advocate for health and wellness at work? Is this physical therapist approaching an organization? It could be physical therapists educating someone who is now downstream, or worker. How would you answer that? How can PTs advocate for health and wellness at the workplace?
Yeah, I think at the workplace, I mentioned this maybe a little bit earlier, is like a healthy, well worker is best for kind of our whole workforce dynamic. So like to a company or a corporation, that like typically a PT that's going to consult or work in industry, they're going to be compensated by the company that they're working with, right? And ultimately, if we can kind of help to influence that culture up top, is really what helps to drive kind of benefits downstream. So ultimately, like the worker is who I feel that I work for, even though like the company is who compensates me for my time. And it's really that biopsychosocial model, right? So we try to kind of, with statistics and data, try to help to influence a company to have a safety first culture. And then in that safety first culture, maybe we should really think about, because part of safety is environment and health and wellness, and how can we have an optimally healthy and well employee that's going to really help to drive, kind of the culture and the buy-in. So a lot of times people feel if a company is invested in them, that they're going to, maybe work good, work hard for that company, versus if they say one thing and do another, then that creates kind of a bad culture as well. So like big picture, I think there's a lot of opportunity in the profession, in kind of health and wellness at work and ergonomics. But also it's getting in front of the right people. Like workers sometimes have limited ability to influence, but it's just kind of continuing to network and really, I think people in the HR side of things are interested, because they want to make sure that they maintain a high quality employee that's right for the job. And then also, a lot of my contacts have been really in the health and safety profession. So people that are really interested in the safety of the worker, not just kind of from an OSHA standpoint, but even OSHA's Occupational Safety and Health Administration, right? So they really do care about the health of the worker, and that's kind of under musculoskeletal injuries or work-related musculoskeletal injuries is really where we kind of spend our time.
In your experience, what are the big KPIs that either HR organizations pay attention to? I'm sure, lost productivity, reducing the number of days workers are out. Are there other metrics that really make their eyebrows go up when someone like yourself starts talking to about what a PT can do?
Yeah, I mean, I think you hit it with productivity is a key one, and then also like DART rate is days away restricted time is really something. So DART, DART is days away restricted time, and that's that's kind of an OSHA metric that's driven. So that's who they really answer to is OSHA. So like I think that those are the metrics that they care about. In the life cycle of a workers' compensation claim, like if you have data and statistics on the cost for an employee to be in the workers' compensation kind of system, then there's a little bit more money lost, not just in costs for workers' compensation, but as you mentioned, kind of lost productivity. So like, prevention's hard to measure. Like it's
Sure.
not an easy metric to try to measure and justify. But I even think the profession as a whole, it's kind of where we're headed. Hopefully, even in our medical system and reimbursement would be to that prevention side. But if we can unfortunately or fortunately, I think if we put a dollar sign to if we reduce injuries by 10%, like this is your savings. And ultimately, like when I talk, like that's the kind of the pitch to the executive leadership team and or those that are making those decisions, but to the worker themselves, I just tell them, like, we want you to go home and enjoy life outside of work, right? Like work can be fun and enjoyable, and it should be, but ultimately, like, we all work to have some type of enjoyment outside of work. So whatever it is that you like to do with your friends, with your family, for yourself is really where we want you to succeed. So we want you to feel just as good at home as you do at work. So leave in the same way you came in.
If a physical therapist is listening, what are some resources you'd suggest that people can use, can learn from that will help them in this particular setting?
Yeah, I think as far as kind of the occupational health special interest group here with the Academy of Orthopedics is a really great resource. They have newsletters, they have podcasts, they have webinars. They have a kind of a home study course, the current concepts of occupational health and archive, and guidelines that are all archived as well. They have recently kind of come out with a occupational health practitioner certification as well. So like that's another kind of component to give you a little bit of a deeper dive and become certified professionally. I think that's another component. Maybe even like bigger picture outside of the PT world. I think the health and safety industry, as I mentioned before, several different states. So like I think the state of Ohio and Washington State Bureau of Labor, like they have some pretty good resources on worker health and safety and ergonomics. And even ergonomics themselves, there are specific ergonomics certifications through kind of the certified professional ergonomist is a certification that would be worth maybe kind of exploring depending on what level you wanted to invest or spend time in this part of the practice.
And we'll put the link to those Academy of Orthopedic Physical Therapy resources. And you mentioned that's a 3-step program on your way of earning a certificate in this particular area. Last thing we do on the show, Gordon, is called Words of Wisdom. Try to wow people. Words of wisdom. What would you want to leave people with who've been listening so far?
Yeah, I mean, I guess words of wisdom. So when we think about physical therapy and in the outpatient world, like generally you're seeing 1 or 2 patients at a time in outpatient physical therapy. And as I've reflected over some of the work that I've done in developing trainings and being a part of integrated part of a health and wellness program with a company for almost a decade, like I've had the ability to kind of influence tens of thousands of people that I've never even met. So I really think like the reach, our scalability and reach in the occupational health and wellness and ergonomics realm is really great and fantastic. So I think we have that ability. If you kind of get in with the company that has the right culture and is really invested in their worker and kind of just global health and wellness, like I think there's a ton of opportunities, something that you can be excited about, and really gives us the ability to have potentially a huge impact. And don't even know the scale of your impact, but you could change somebody's life for the better. So yeah, I think that's something that I reflect upon.
Very much so. Gordon, thanks so much for helping us understand better the role of orthopedic physical therapy in workplace health. Appreciate your time.
Thank you, Jimmy. I appreciate you having me on.